Okay, welcome. I'm Professor Khalid Khan. I am at the University of Granada in Spain, and today I have with me my colleague Dr. Balesh. Balesh, can you please introduce yourself?
Yes, thank you for inviting me. My name is Balázs Juhász. I'm a medical doctor from Hungary, and I am doing my PhD research at the University of Granada from public health.
Okay, so we are going to talk about a subject that is disturbing. It concerns abuse of the elderly in society. The topic is relevant because we are right in the middle of what the United Nations has declared the decade of aging and health. I will ask Balesh to define first what is an elderly person in the context of the work we recently published.
So, defining elderly people is arbitrary, but the United Nations says an elder people is someone who is at least 60 years old. And estimations say that by 2030, one in every six people in the world will be elder.
Okay, so I'm going to turn 60 this year, so I will fall in the bracket of uh, the definition of elderly. How might you define abuse?
Elder abuse is defined by the World Health Organization as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. The consequences can be dire. It could lead to depression, other mental health issues, chronic pain, even metabolic syndrome, more frequent hospitalization, and increased disability and overall mortality. And we often classify elder abuse into subtypes: psychological, financial, physical, or sexual abuse, or neglect, which is the lack of helping an elder person.
Okay, so returning back to the paper we published with other colleagues, this appeared in the Journal of Primary Care in Spain. What can you tell us about this work, Balesh?
So we performed an umbrella review. Umbrella review is at the top of scientific evidence as it reviews what is already published, and we compare systematic reviews to get to get a broader picture of the phenomenon. And the methodology we applied is outlined in the slide. In the end, after reading a lot of citations, we included 16 systematic reviews, and these 16 systematic reviews covered more than 130 primary studies.
Okay, so there is a lot of literature on the prevalence or the rate of this problem. What can you tell us about the rates reported in the literature?
Indeed, there are a lot of publication, but the quality of this publication is varying. What we can certainly say is that elderly abuse is a common and frequent problem. And here in the figure, you can see the prevalence ranges of elder abuse. And I would like to outline that it is alarmingly high in the care setting. Um, so when an elder person visits a healthcare professional, there is also an expectation of trust, and they can get abused in a system that should be protecting them.
Well, so that is really alarming and concerning for family and friends of the older people. Uh, in the data that you show us here, why is there so much variation?
Of course, there are different provisos in estimating elderly abuse. I just like to highlight one example that most of the estimations are self-reported estimates, which can under or overestimate the problem.
Okay, well, having established that the problem is common, people are at risk. What are your conclusions?
So first of all, there is still a need for robust studies, and most of the studies that we encountered were performed in high-income countries. So future studies should focus on low and middle-income countries, and also in the institutional setting. And it is urgent to better the education of healthcare professionals on the matter, to better prevention and early detection of elderly abuse, ideally at the level of primary care, because family doctors and family nurses are in frequent control with elder people and probably know them better than, for example, hospital colleagues.
Okay, so, well, it is really concerning that in countries with resources and education, that their elderly population is at risk of abuse. Those people who have elderly relatives and friends, what can they do?
uh, of course, we don't have to be policymakers to help. We can check for signs of abuse. These might be apparent, like signs of physical abuse, bruises, or scars, but could be more nuanced and sophisticated, like, for example, depression or change in behavior. And it is important to regularly check in old friends and relatives and let them know that we are there to help them, ask them to report problems to us if they need help. And we don't have to solve the whole case alone, because most countries has well established systems, so we can report it to police or social workers. The important thing is to detect the problem and get help.
All right, Balesh, thank you for making us aware of this important issue. And here we also highlight that the World Elder Abuse Day is celebrated in June every year. Thank you very much.
Thank you for the opportunity.